today one of North America's most distinguished heart disease physicians, and that is Dr. James Liao, who joins us from the Harvard Medical School. Dr. Liao has had an extraordinarily distinguished and busy research career in teaching, in clinical research, for example, as the director of the Vascular Medicine Research Center at the Brigham and Women's Hospital in Boston, Massachusetts. There's a very lengthy list of publications with an interest in heart disease and atherosclerosis, or the building formation of plaque, and he's had a number of different research awards. So it's my privilege and honor to present to you Dr. Liao. The format for today will be inviting Dr. Liao to present to us for about 5-10 minutes, and then we will all be available for questions of different nature. Dr. Vanson Lee will be very pleased to provide answers to you in Cantonese and Mandarin, and so on. And without any further ado, I'd now invite Dr. Liao.
Thank you very much. I thought I'd probably just begin this session by sort of giving a broad overview of where we are in terms of Asians and South Asians and what the medical issues that will confront us in the next 2 decades. I think when one looks at, for example, cardiovascular disease, historically it's been very low in the Asians and South Asians. However, recently the incidence of cardiovascular disease has risen dramatically. In fact, if one compares the Asians and South Asians with the Europeans, really the South Asians and the Asians have really had a dramatic increase in cardiovascular disease. And I think most of this is due to the influence of Western diet, probably on top of successful genes in the Asian population. And the other is the obesity rate, or the incidence of metabolic syndrome, which is the finding, obesity is one of the major findings of metabolic syndrome, has increased dramatically. Now, metabolic syndrome and obesity has led to a dramatic also increase in diabetes, which is increasing at the highest rate in the Asian population, increasing about 50% year over year. And it's estimated, the World Health Organization estimates that in the year 2025, there will be 300 million diabetics worldwide. And 2 countries in the world will have 1/3 of all the diabetics, 100 million. And those 2 countries are China and India. China will have 58 million, India will have 58 million diabetics, and China will have about 40 million diabetics. So I think the increase in cardiovascular disease can be traced to the increased incidence of diabetes. And the question is, what therapeutic regimen do we have to confront this rising challenge of diabetes and coronary heart disease? I think certainly one option would be try to take better care of the diabetes, the glucose intolerance, as well as the obesity. But I think when one looks at cardiovascular therapeutics, there's probably no better drug that we have today than the statins. These are HMG-CoA reductase inhibitors. These drugs work by inhibiting cholesterol synthesis in the liver, and they lower cholesterol from anywhere from 30 to 60%.
Equally disposed to cardiovascular complications.
Because I think it's a little too simplistic. I do agree with him that that environment plays a very major role